Hey you guys, happy Sunday. So I'm on a break now from doing the COVID testing for a little about an hour more, and then I have to go back into doing testing. So I wanted to say hi and say hi to the new people who are new to my page. So if you don't know me, my name is well, you can see that. My name is DeLorean. I am a family nurse practitioner for about 5 years now, a nurse for almost 15 years, and I'm currently doing testing in the Houston area for COVID-19. That's the job that I'm doing right now for probably until the end of the month, and then we'll see what happens after that. But I wanted to jump on here because I was reading, of course, it's in the news everywhere, and everything is about COVID testing, and it can be pretty overwhelming sometimes. And a lot of times people don't know what to do. People don't know what they can do to prevent it. And we know what we know if we get sick and go to the hospital and stuff like that. We know about wearing gloves and wearing masks and stuff and staying at home, which is all very, very important. But I think that there is a conversation that's not being had about the risk factors for contracting COVID and being severely impacted by it, because as the rates go up, we know that a good amount of us are going to get sick from it. We're going to get it. We're going to contract it. A good amount of us are going to contract it. The question is, if and when we contract it, are the things that we have already going on with us going to make it harder for us to get over it? Now, you hear about a good amount of people who are being able to be discharged from the hospital, and the rates are good for that. Something like 80%, but the other 20% of people still are suffering. And we're afraid that the numbers of deaths are going to go up, and there's not going to be enough of us healthcare providers able to help take care of those people. And that's a really, really scary thought. And so looking at the risks for being severely impacted, we all know that the elderly are more at risk. But what about the other things? Immune compromise doesn't always mean cancer. If you smoke, you are compromising your immune system. So, think about that. People that have diabetes, that have family members who are diabetic, they are at higher risk. So if, God forbid, they contracted it, they would have a very difficult time with it. And if they had to get on a ventilator, which is what helps people to breathe, because the virus, what we're saying, is causing people to have pneumonia. So the virus causes pneumonia. It causes pneumonia in multiple parts of your lungs. And then it progresses, and the only way that we're treating it is by putting people on these ventilators. So that's when you're hearing, the Cuomo in New York saying we need more ventilators, is because really once it progresses, that's the only thing that they can do, and they keep these people on ventilators for weeks. So what can we do to help to reduce the need for those ventilators? And that's reducing the risk factors. So diabetes is preventable, right? Diabetes can be, in a sense, reversed once you control it. If you have uncontrolled diabetes, now is the time to focus on your health. Now is the time for you to get your health in check. We're all sitting at home. We don't have things to do. People are eating up all the snacks. This is not the time to eat up all the snacks. We don't want to come out of this on worse than when we started. If you're diabetic, if you're immune compromised. But the other thing that hits home for a lot of people, especially here in Houston, if you have asthma, if you have a chronic lung disease, which a lot of people, if they smoke, they have a chronic lung disease. So I have family members that have that. That puts you at an increased risk, because God forbid you have to get on that ventilator. Again, it will be very, very difficult to get you off if your lungs are already compromised. And that's where the virus hits, is in your lungs. So controlling your asthma. If you have COPD that's caused from smoking, now is the time to think about and to stop smoking. I know it's difficult to stop smoking when you're in a high stress situation, which a lot of us are in. but at least come up with a plan. At least try to have a date in mind and come up with a plan to stop smoking, so that can reduce your lung disease. And if maybe some of it, if it's allergies that's contributing to your asthma, control your asthma. Sleep apnea. I have sleep apnea. A lot of people I know have sleep apnea. A lot of people I know have undiagnosed sleep apnea, which is when you are having your oxygen drop when you're sleeping, or you stop breathing when you're sleeping. And so if you snore, if you have a wider neck, if you have your partner that said that you may have stopped breathing in the middle of the night, or you snore and then it gets really loud and it stops, those are signs for sleep apnea. That puts you at a higher risk, because if your oxygen drops when you are sleeping, you're not getting proper ventilation. So if they have to put you on a ventilator, you're already going in like at a worse, I can't even think. You're going at it at a worse way than someone who didn't have sleep apnea. And lastly, the one that hit home to me the most was severe obesity. And that is having a body mass index of over 40. So it's really easy for you to figure out what your body mass index is. All you have to do is just go to Google, and just put in BMI calculator. And it's a calculation with your height and your weight, and it gives you a number. If your body mass index is over 40, you are in that severely high risk category. And I don't think that that's being talked about enough. Here in the United States, there's so many people who are severely obese. I'm considered severely obese, or morbid obese is what they call it, when you have a body mass index over 40. And so reading that, knowing that either you or someone you know more than likely has one of those boxes that they can tick, I hope that that's a wake-up call for all of us who are sitting at home, who aren't moving as much, who are not taking care of yourself as much, to really take a step back and see, what can I do to help myself to if I have to get this virus, how can I fight it? Aside from staying at home, aside from cleaning your hands and, not touching your face and all the things that the government is saying, take control of your health. This is the time for you to do that. This is not the time to sit up and have quarantinis all day and eat Oreos all day. And nothing wrong with a quarantini every now and again. I'm not hating on that. But this is the time for you to focus. You have plenty of time. Most of you have plenty of time. Now, I know some people say, oh, well, I can't work out because I don't have, I can't go to the gym. You can go outside. You can take a walk. You can pull up YouTube. There's tons of videos on YouTube that are free. Of course, you guys know that I personally love Beachbody programs, and so it's easy to get. You can get 2-week trial. If you want to know about that, let me know in the comments, and I can hook you up with that. You can work out from home. Get some of your friends, all these Zoom calls. Get on a Zoom call. You guys work together for accountability. Think outside the box, and let's stop making excuses on why we can't do stuff, and let's all be proactive, because I hate being reactive. I guess it's the word I'm thinking about, but I hate always, trying to fight something, and we want to prevent that. So now is the time to focus on your sleep, get good quality sleep, drink lots of water, not a lot of soda, and start moving and take care of your health, okay? I hope you guys have a great rest of your Sunday, and let's just all focus on staying healthy, okay? Have a good day. Bye.